Hi, I'm Melissa, registered dental hygienist and proud Burst ambassador, and you're watching Burst TV. So, I've been a hygienist for 18 years, and I feel like overall, clinically, I've had a great experience. But I really wish I had a lot more insight into my career now that I'm looking back. And so, I thought it'd be great to do a Q&A with some of my fellow hygiene friends and Burst ambassadors, Miss Gretchen and Krismichelle. I think this would be great for someone that is interested in pursuing a hygiene career and learning what hygiene's all about. So let me introduce you, Gretchen and Chris.
Hi guys.
Hello.
So how many years experience have y'all had as a hygienist?
So I graduated from hygiene school in 1998, so since the 1900s.
And Miss Chris Michelle, what about you?
I've been a hygienist now for 9 years, so
Okay, yeah. So I feel like we are very seasoned hygienists, and we all have, of course, different backgrounds, but of course, our focus are is caring for our patients, right?
absolutely.
So I wanted to ask, what are some of the things that you love most about being a hygienist? Chris Michelle, I'll let you go first.
It feels like a cliche answer from all of us, but I think we're all people person. So I do love getting to know new people or see the same people and build that rapport with patients, and you get to know them even on a very personal level to the point, you're wondering like, hey, why weren't you here the last 6 months or 4 months or whatever. So yeah, that's my favorite part is that.
That connection. I agree.
Mhm.
Yeah, I totally agree with that. Also, before I decided to change my major to dental hygiene, I was actually an education major for 3.5 years. And, I love being able to educate people on how to take better care of their entire body, but mostly their mouth. And then, you see them again in 6 months and they're like, oh, you were right. When you floss, it does help. And again, the rapport, but just from a personal and educational and health
Yeah.
perspective, I guess.
Yeah, it's interesting because it's like I feel like I'm almost like a counselor to some people. You just they really get excited when they see you and they get to like come in your chair and they're like, "Oh, yes, you're gonna clean my teeth, but let me tell you what's I've been doing for the last 6 months." So I just love that connection. I agree. So now what is the worst thing you've ever found stuck in someone's teeth?
Besides hair, I feel like the one thing that I did find that was kind of crazy, we had a patient that had treatment done 2 weeks or 3 weeks before I had to clean his teeth, and they had cotton still in that area that they were working on. I think they had told that patient to take it out, but maybe he misunderstood. So when I was cleaning, I was literally like, what is this? So I'm like, oh, this is cotton.
Oh,
Wow.
So,
wow.
Hope
That's
you're wearing
gross.
that.
yeah, it was pretty gross. Thank goodness for masks.
Yes.
So,
Right. Yeah. I would say the grossest thing was having patients with dentures who did not take them out to clean them after multiple meals. And
Yes.
you know exactly what they had.
Yes,
yeah,
exactly. Rotten meat and everything. Oh, yes.
Yeah.
yeah.
Well, yeah, so that's good, definitely good experience for someone just to prepare themselves.
And hair.
And
Exactly. Or
yeah.
nail clippings too. It's like, oh,
Mm.
okay. So what is the
Yeah.
best patient excuse that you've heard about why they don't like to floss or brush their teeth? Gretchen?
I had a patient that she said she doesn't have to floss because she eats salad. I'm like, yeah,
The
that
more
was a
reason you
little more
shouldn't.
education than I'm used to on that.
I feel like I can't remember what was the best excuse, but I always hear like, oh, it's because you're already flossing my teeth, or I already flossed the last 6 months. You hear that joke all the time. So
And of course, it never gets old when you're like, they're like, oh, well, my gums always bleed. That's why I don't floss. I'm like, well, your gums are bleeding
Always.
because you're not flossing.
hmm
Yes. And trying to get them to understand that difference of what they're saying versus what we're saying.
Exactly.
hmm
So now, do you recall a
I,
particular situation that made you laugh the hardest?
I work at a pediatric dental office, and I had a patient, 14-year-old, going through puberty. He had the facial hair right here, special needs. And we just had the best time picking out the toothpaste flavors, and we just had a great time. And Dad was with him, and whenever it was over, he went to hug me, and I have no problem with patients hugging me. Well, he went to hug me, and I'm facing his dad, and his dad is like, "No," and I'm thinking it's just a hug, it's fine. Well, he cocked his head and started kissing me on the neck.
You got a little extra TLC there.
His dad was mortified, but I thought it was funny.
The funny and maybe awkward, well, I guess funny, was how important it is to read your patient's health history, because when they're pre-medicated, I guess I was still a very newbie hygienist. So I thought, oh, they've obviously had like a joint thing or it's a heart thing. And so I kept asking the patient like, so how's your heart? And they were like, it's fine. Like, so, like, because you're on pre-medication, like, yeah, I don't feel like I need to. And I'm like, okay, but your heart, she goes, my heart's fine. And come to find out, it was actually we were talking about her breast augmentation, and she was just like, that's what it was for. It was like, oh, that didn't even realize that was. She's like, my heart's fine, it's my breast. I was like, oh, that was new. And come to find out, there was some type of correlation between pre-medication and breast augmentation, so, or breast
Yeah.
surgery. So that was a newbie hygiene moment.
One of those things you will never forget. So has there been anything that a patient ever did? Well, I guess the awkward moment for you, Gretchen, right? But anything that was awkward for you with a patient? I have one, if you don't mind me sharing. So I was actually just, doing a cleaning, and I had my scalers in my hand and my mirror in the other hand. And I had a patient that I knew for about 8 years, and he was extra comfortable, very comfortable with me that day. He decided to turn around and hug me. And I was like, can you please stop hugging me? And so let me just tell you, after that cleaning, I told my doctor, I'm so sorry. I just don't feel comfortable with that patient. So it's one of those situations that I hope people, are aware that, that maybe it was innocent, but it made me very uncomfortable. And, when you're in that position with a patient, you're close with the patient. So I hope anybody that is a hygienist is aware that you are going to be connected with somebody pretty closely, and just to be aware of your space.
When I came back from my maternity leave, now we have wireless pumps.
Oh,
So
yeah.
I was pumping during my patients, and there's many times we're like, what's that pumping sound? And you would feel like it should be cool because it's you're pumping your milk for your baby, but it's always feels awkward, like, oh, it's me. It's me pumping.
I do have two other things that were more awkward than the neck kissing. One of them, I was newly out of hygiene school, like maybe a year or two in, and there was a patient that had some brain trauma that I knew about. But when I was done with the prophy and I went, told the dentist I was ready, and I was waiting for him, he put his hands around my neck because I told him he could not smoke in the chair. Yeah. So that's probably the most shocking thing. But I did have another one maybe 5 or 6 years ago, and I knew that this patient was going to do it. He had done it to every hygienist before me, and they all let him. When you would go to polish his teeth, he would put his hands around the hygienist's waist, and he would say, if you tickle me, I tickle you. So I said, then I'm not polishing your teeth. And he was upset. And I'm like, I don't care. I had already talked to the dentist. He knew I was going to put that boundary up. And then he said, okay, well, I'll keep my hands to myself. I'm like, then I'll polish your teeth. Yeah. So, but I've had numerous men think it's okay just to rest their hand very gently on my thigh.
Oh, seeing
Yeah.
that one instant when I had that reach around, that made me so uncomfortable. And he was a married man. It's just,
Oh my God.
Yes. Yeah.
just
And a
like,
lot of times I see the wife.
Oh, yeah. I'm like, please let go of me. So here's a good one. Have you ever had a patient make you cry? I've had lots of patients. And it's, with luckily I've had an experience with working with one office for 14 years. So you connect with these people, and they become almost like family to you. And when a lot of them have had their husbands or wives pass away, or their children or their mothers, and they come in and they just break down, I can't help but cry with them. And it's emotional. It's emotional, or they're going through illnesses, or it's you connect with them. And so I know I've had a lot of experience with crying, and I am an emotional person too. But is there anyone that has had a similar experience that made you tear up, and for good or bad?
I agree. I feel like because you become so close with these patients, because before temping, I worked in the office for 6.5 years, so I knew a lot of patients, a lot of older patients, and then you hear all their stories, or even young patients that have, stories, health issues that they've dealt with. So yeah, you cry with them. But I definitely have cried from patients who were rude and mean. And even in hygiene school, I think I cried a lot. But I
It's tough.
remember I had a patient who was a physician, and he was disagreeing with me about x-rays and kind of belittled me, and he was just very condescending, and he did make me cry. And luckily at the time, my doctor and team, but my doctor especially, she stood up for me, and she, you know, was able to support, what I was saying. And he eventually was like, of course they're like, oh, the doctor says it, and of course I'll do it. But I was just happy that I had that backup at the time.
I do a lot of work with the American Foundation for Suicide Prevention. I remember one patient a few years ago, and I had never met him before. And I brought him back into my room, and I just kind of, I'd already reviewed his health history, and I'm like, so how are you? And he looked me in the eye and he goes, I think I'm depressed. He didn't know anything about me. I didn't know anything about him, but we spent a good 20 minutes just talking about it. I'm like, it's winter. Have you been outside? Maybe you should garden. Have you been with family? So it was very emotional, but I think it was a beautiful thing that he actually reached out to me
Yeah,
and said that. And
that's
my
so
boss came in
funny.
and started talking about other, because everybody knows about medication, but there's so many other things. And she came in and we all just, like the three of us were just talking about things that could benefit him. So that was happy tear, sad that he was going through, but so happy that he opened up to me.
And you were able to help them. Gosh,
Yeah,
amazing.
hopefully.
Yeah, exactly. Um, so what was the most creative way to help a patient in maybe explaining oral hygiene instructions? Was there any tips that you would recommend to share?
I think my favorite thing, and I always ask permission before I say it with flossing. I always say, um, you know, I'm going to tell you why you should floss. I'm going to show you the proper way to floss, but I can tell you something that will make you floss every day, but it's a little gross. And I say, do you want to hear it? And if they say yes, then I just say, if you brush and don't floss, it's like going number two and only wiping your butt cheeks. And they're just shocked. And I just say, if you ever doubt what the bacteria is doing under your gums, smell the floss.
Mhm.
And just that light bulb goes off, especially for teenage boys. That light bulb's like, click. Oh, that's what the girl smells when she talks to me.
Yeah. The intraoral photo works really well too, just showing like this is what is on your tooth right now. They're scraping
Yes.
off and then showing and then having them smell that, the 2 by 2. This is what I
Yep.
just removed. Yeah.
Yeah.
I had a patient, he was a dentist, and he calls it the gauze of shame.
Oh my gosh, I'm gonna have to use that one.
I think I've always used like the dog bowl or your pet bowl, if you don't change it out or clean it, or the sink if you leave the dishes in the sink or whatever and let the grime just harden. And I always tell people, but they seem to know, even though I'm hardly on any boats, but they always say barnacles. I'm not that fancy to be on a boat like that, but I always remember always mention that.
Good
It's
one
like
though.
barnacles on a boat.
What did you wish you knew before getting into this career? For me, I think I wish I knew about like how a lot of most dental offices, if it's not corporate, if it's, private practice, you don't get maternity leave. And so those 6 to 8 weeks that you're not working, you're not getting paid. So, and after 3 kids, I mean, it's it cost us a lot of money with me being off, and also the physical, how physical it is on your body. So
At my age, since I'm more seasoned, y'all, I have a lot of friends that are hygienists and they've had back surgery, neck, shoulder, carpal tunnel syndrome, thumb, wrist, so many things with the physical part of it. But something that now that I'm single, I never thought of. I know, maternity leave and all of that, but most hygienists don't have the option to get any benefits, insurance, again, sick days, vacation days. Most offices aren't even open 40 hours a week. So none of us are full time. So that is definitely a lot more challenging now that I'm single. It's a whole different ball game.
I also agree too. I think the benefits, not realizing that because my office was small, you didn't have to have benefits. We didn't have maternity leave, perks to that. And also me being the only hygienist at the time, it was like flexibility was very, very limited. You would feel guilty like asking off, it just you realize like you're always working every day and you're seeing a patient almost every 30 minutes to 45 minutes to an hour. So yeah, it takes a lot on your body.
We do a lot of sitting, we do a lot of moving, but also at the end of the day, just the emotions, because I'm in pedo most of the time now, so I have a different patient every 30 minutes. Their feelings are all different, their energy is different, and you have to match that so they feel comfortable. So at the end of the day, when you've matched the energy of 14 patients,
Yeah.
like coming home and just exhaling, or I think it's very important to get vitamin D, go outside, go to the gym. You've got to do something to take care of yourself. But, my kids laugh when I'm home. I don't have music on. I don't have the TV on. I just want quiet for a little while at
so
least.
plus,
No drills, no
same
suction, no
way.
laugh.
I want silence. Exactly. That's how I feel.
Yeah.
Like you're talking so much, and I enjoy it. I love it, but it at the end of the day, it's exhausting mentally, physically. Um, Absolutely. So
I think something on a positive, I never, and maybe it's with all occupations, I don't know, but when you bond with somebody that does the same as you, like the three of us, we haven't known each other very long, but when we get together, I mean, even just being on Zoom, like just that automatic click, that bonding, that sisterhood, siblinghood, because there's guys out here too, and I don't know, I never realized just the true amazing friendships that can be made throughout the rest of your life just because we do the same thing. So that's just such a huge blessing
great
of
connection.
being a hygienist.
Absolutely.
That's so true. Yeah, I think being a hygienist, it's fun. It's kind of like we're like yeah, I don't know if flight attendants exact, but I feel like we're kind of like the fun the
Sure.
flight attendants of dentistry because we're just like we're
Yes.
all cute, we're having fun, like
Exactly.
clock in, clock out. Like it's and you're right. No matter when you meet a hygienist, you have that instant bond because you just know you if you know
Okay.
you know. So I
Exactly.
agree.
Yeah. Well, I just want to thank you guys so much for joining me. And I really hope that this will help future hygienists. And if, especially if somebody is still not sure if this is something they want to do. And if you're in hygiene school, good luck. And we are hoping that you have an amazing journey to becoming one of our colleagues. And thank you so much for watching Burst TV. And make sure you hit the subscribe button if you haven't already, so you don't miss out on our weekly segments. Take care.